Naloxone kits have become a familiar sight across British Columbia, but the free injectable overdose antidote requires training and isn't always easy to use in an emergency.
Maybe it's your loved one and you're shaking. To make it easier for someone just to use the nasal naloxone, we should be making this a priority.
There's almost no training costs, and any layperson can use it.
BC began a pilot project a year ago, but government hasn't taken next steps. Now frontline healthcare providers are urging the province to follow Ontario and Quebec and make nasal Narcan free.
What's the holdup? We don't see things this often that are just win-win-wins. There's always issues with delivery or training. This seems to be one of those things where other provinces have really invested in this because they've seen the benefit.
Anything that increases the likelihood of somebody carrying a naloxone kit, of being prepared to use it, of having the confidence to use it when an actual emergency arises. I don't think there's anybody on any end of the political spectrum who would be opposed.
After the accidental death of a student, UVic installed inhalable kits in student residences. With 1 in 5 toxic drug deaths among construction workers, the industry is asking for the same at BC work sites, joining other longtime advocates.
That's what is available in Ontario and Quebec, so I think BC should be looking at those provinces.
In Ontario, transit stations and even some libraries hand them out freely.
We don't ask to see any ID, we don't ask for a library card.
And researchers at the University of Waterloo concluded
the nasal spray, even though it is a little bit more expensive, it still is cost effective.
I'll have more to say about that soon. We want to make sure that it gets into the hands of the people who need it most.
When pressed as to why it's taking so long to decide, the health minister said
is a really important harm reduction tool, again, that saves people's lives, and I'll have more to say about it soon.
Injectable kits expire after 2 years, while the inhalable form is good for 4. Penny Daflos, CTV News, Vancouver.